Alright, so for times when Loretta's going to be wearing her sock, which will be at night while she's asleep in her cage, or if she's going to be unsupervised for a long period of time, or if you're hanging around the house and she's really going at her foot and you need her to stop.
And you can't watch her.
You can't watch her, so what we do is we just take this infant sock, kind of put it on her. I try to always just make sure that I got it pulled up just as far as it can go, because it's going to always tend to slip down. So I really try to make sure that the tip of her foot's really down in there. And then what I'm going to do is I'm going to take these pieces of elastics, and I'm just going to tie them around, one around her sort of ankle here. It's important that when you do this, try to do it so that it's kind of tight enough so that the sock's not going to slip off. But if you do it too tight, it will cut the circulation off to her foot. So don't do it too tight. You'll have to just find the right balance. If it's too loose, it'll come right off, or she'll pull it right off. If it's too tight, that'll be bad.
Will swell.
Foot will swell up. So just kind of pull it a little bit, and that's it. So
Make sure she can bend her knee.
Make sure that for everything, when you're putting the sock or the boot on, if you make sure that she can bend this joint here, it'll be much easier for her to walk around. And she can walk around the house with this. If it's dry outside, she could even go outside briefly if she needs to have a pee or something. But just make sure that it stays clean. Okay, so this is the Metapaw. This is her boot that she's going to wear if she's going to be outside for long periods of time, especially if it's raining or gross outside. What we're going to do is we're really just going to put it on her foot. Again, let's just make sure that it's all the way, that her foot is really as far in it as we can go, close to the tip. And then it's pretty self-explanatory, but the Velcro just wraps around.
Can't see.
Velcro just wraps around. Try to get it pointed the way that her foot would be going, and then also just make sure that her ankle can bend, that this here can bend, that it's not too tight, and that's really it.
And she can walk well with the boot.
She can walk pretty well with this. You can, if you're going to be going out for a long period of time, you can also leave this on her with her hood. Not a good idea to leave this on for a lot of the day, because her foot will tend to swell up. But if it gets to the point where her foot is basically healed and not really infected anymore, she could wear this more and more.
Okay.
Yep.